Hello, everyone. My name is Iliana Kohler, and I'm the principal investigator of the LDA Rapid Response Grant that documents the experience of healthcare providers in Malawi, a sub-Saharan African low-income country, one of the poorest countries in the world. Healthcare providers in low-income countries represent a population of specific concerns since they are characterized by high infection risks, high mental health burden, and limited access to personal protection equipment, um, and face many other challenges. Many of the lessons we learned from high and middle income countries how to address the needs of healthcare providers during the COVID-19 pandemic do not necessarily apply in this context. For instance, sub-Saharan African low-income countries face specific challenges such as resource-constrained healthcare systems, supplies limitations, and this is also a context where social distancing is very difficult to be implemented in highly populated, densely populated areas and in subsistence agricultural societies. This research fills important knowledge gaps that are essential for health policy responses targeting specifically healthcare providers during the COVID-19 pandemic. The overall aim of the project was to collect information on healthcare providers during the COVID-19 pandemic in Malawi, evaluate their preparedness to address the pandemic, assess the unique COVID-19 challenges healthcare providers faced during the pandemic in this low-income context, and to assess the impact of the pandemic on healthcare providers' burnout, which we do by implementing the Maslow burnout inventory, and on mental health, which we do by implementing the PHQ-9 instrument to measure the presence and severity of depression. The first COVID-19 case in Malawi was documented in the beginning of April, and our study was implemented in the second half of August when the number of reported cases started to decline somewhat. However, shown in this figure, the number of reported cases in Malawi um, inc- began to increase dramatically since mid-December 2020, which suggests that the country may be facing a second wave of the pandemic. The basis for this study is provided by the Malawi Longitudinal study of families and health, which documents the experience of the rural population in 3 districts during the HIV/AIDS epidemic and the consequences of the epidemic. And most recently, the study documents the experience during the COVID-19 pandemic. The healthcare providers were interviewed for the first time as part of MLSFH in 2019, and in 2020, we conducted interviews, phone surveys with 110 healthcare providers that serve the MLSFH study areas. Specifically, we interviewed 40 healthcare providers, mostly based in healthcare facilities, which includes doctors, nurses, and other medically trained personnel. And we interviewed also 70 HSAs or community health workers. The interviewed healthcare providers reported the impact of COVID-19 on healthcare. For instance, about 53% of the healthcare providers and one-third of the HSAs reported that they see fewer patients approaching them for NCD-related healthcare. Between 23 to 30% of the interviewed respondents reported that fewer patients are seeking maternity and child healthcare or access to contraception. Only 3% reported shortages of ART for HIV/AIDS treatment. However, 21% of the interviewed healthcare providers and HSAs reported fewer HIV-positive patients seeking care. About 90% of the interviewed respondents reported that they have received information about COVID-19 prevention strategies and transmission pathways, and they were also provided with protective equipment such as masks. However, less than 64% of the interviewed respondents reported that they have received any information about how to deal with stress experienced during this pandemic or how to deal with how to address mental health issues. A substantial fraction of the interviewed healthcare providers reported the experience of high burnout. For instance, 30% among the female healthcare providers and HSAs reported high burnout, and about 22% of the male healthcare providers. If we look at by provider type, 20% of the HSAs reported high burnout, but almost 29% of the facility-based healthcare providers, that is, among doctors, nurses, and other medically trained personnel, reported the experience of high burnout. Our longitudinal analysis also suggests that burnout increased between 2019 and 2020. We also look at the relationship between burnout and mental well being of the healthcare providers, and our results suggest that healthcare providers who report high emotional burnout are also more likely to report the presence of mild or severe depression. To sum up our results, one of the key findings of these projects is that healthcare providers experience high emotional burnout during the COVID-19 pandemic in Malawi. This pattern is of a particular concern since Malawi is currently experiencing a second wave of COVID-19 cases, and we need just to keep in mind that healthcare providers are not only dealing with the COVID-19 pandemic, but they still continue to deal with the HIV/AIDS pandemic, as well as many other healthcare related challenges. The project suggests that the needs of healthcare providers need to be specifically targeted by public health policies in this context. I would like to gratefully acknowledge the support of LDI for this research and this data collection, and I would like also to acknowledge the members of the MLSFH team, both here at the University of Pennsylvania and in Malawi. Thank you very much.